Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Aspirin induced asthma. Okay. Aspirin induced asthma. Actually, aspirin will block the COX enzymes, and as a result, there is decreased production of thromboxane A2 and there is decreased production of prostaglandins. So, in patients with aspirin induced asthma, actually, because the aspirin is blocking the aspirin will block the production of thromboxane A2, and it will also block the production of prostaglandins. So as a result, this phospholipid which is present, instead of going in this pathway, it goes into this pathway, and as a result there occurs increased production of leukotrienes are seen. Now this leukotrienes will cause bronchoconstriction and bronchospasm, thus they will cause severe asthma like features are seen because of bronchoconstriction, and this is also produces allergic like effects are seen. So in aspirin there is a triad which is called as Samter's triad. According to the Samter's triad, we have asthma, then we have ethmoidal polyps are seen, and there is also aspirin is also seen in this Samter's triad. Then contraindications of this asthma. Yeah, so because of that, asthma is contraindicated, sorry, aspirin is contraindicated in asthma.
thank you and thank you for watching.